Hello there, lovely people. Welcome back to my YouTube channel. For the new viewers, my name is Caroline. I'm usually the host of the show, and I'm so happy to be back. And as you can see, it is raining here, and I'm trying to make my voice as audible as possible. And today we're going to talk about minor disorders in pregnancy, and these are just changes that might be a little bit uncomfortable to the pregnant woman, but they can be managed with home remedies that are safe to the mother, so that the mother can feel better even as she enjoys the journey of pregnancy. And I'm just going to mention but a few, but the most common ones. The first one is vomiting, which usually happens during the first trimester. And what I can advise the mothers to do when you notice that you are vomiting, you can try to take a meal that contains protein before you go to bed. And also, like in the morning hours when you wake up, you can take a banana or a dry bread. That might also help. Also, try to take small frequent meals. Don't eat meals that are large quantities, because that might exaggerate the vomiting. Alright, but in case the vomiting increases or it gets worse and you've tried all the home remedies and they're not working, kindly come to the hospital. Okay, I wanted to say come to us, but you can go to the nearest hospital and talk to your healthcare provider, and they might be able to prescribe something for you that is going to alleviate that. The other thing that is very common is heartburn that happens in pregnancy, and it is because as the uterus continues to grow, it pushes the stomach, because we all know the stomach is the one that carries the food that we eat, and when it does that, there is that acid that helps in digestion, so that is the acid starts going up, and that is why you feel the heartburn. And how can you be able to manage that? You can eat small frequent meals, so you do not also avoid taking large amount of food at a go. Also, avoid the spicy food, the greasy food, because that might also continue to increase the heartburn. The other thing is anything you can take something like a papaya, a pineapple, because they help in the digestion. They have that enzyme that helps in to facilitate digestion. Okay, the other thing, when you're lying down, try to put your head higher than the rest of the body. You can raise your head with a pillow. That is going to help, because the acid is not going to really regurgitate or come up very as you lie down. Okay, the other thing, you can try calming the stomach with drinking milk. Milk might help. And also, if it becomes worse, you might just need to see your healthcare provider, and they might prescribe something for that. But we always say try the home remedies first, and if they don't work, now that's the time. Now you go and try the other things like the antacids. Okay, sorry for that, there was an interruption. Sorry for that, I'm easily interrupted. The other thing that is very common in pregnancy is constipation, and we know there are so many hormonal changes that affect the normal movement of food along the gut, and that is why now you see the mother gets constipated. And what can you manage? How can you manage that? You just need to eat a lot of fruits and also vegetables, and drink lots of water. We say pregnant mothers should take at least 2 liters of water and more. Okay, the other thing, you can try walking, exercise, that might also help. And also take a lot of fiber. That is going to really alleviate the constipation. The other thing that is very common, it is swollen veins, and in swollen veins we do have the varicosities and we have the hemorrhoids. I will start with the varicosities. They usually happen along the legs, and we all know it is because of the pressure that the uterus is applying on the vessels or the veins that are taking the blood back to from the legs to the heart. And so when that happens, the pressure, that is why you see the veins, they start to like to coil, or how can I yeah, like that, to coil. I don't want to use the very big medical terms. So that happens maybe when you are even when you're standing a lot, that is going to get worse. So what can I advise the mothers? Try to elevate or put your legs higher when you are lying down. Avoid hanging your legs most of the time. If you are resting, try to put your legs higher. You can put a pillow and then you put your legs above the pillow. That is going to help. Also the stockings, those one come in handy. Try to use the stockings because they're going to compress the veins, and that is going even to become better. The good thing about it is that once the pregnancy is over, they usually go away by themselves. The hemorrhoids, which are very, very common, we know these are there are swollen veins around the anus, and just the same way, it's because the uterus is applying a lot of pressure on those veins. That is why they do happen that way. When you are constipated, they might get to bleed, so we always advise, if you have hemorrhoids, avoid getting constipated. So you need to take a lot of water, take a lot of food with fiber like cabbages. That is going to help. And also I said about taking a lot of water, and also avoid sitting and standing a lot, because that is going to make them worse. The other thing that is very common in pregnancy, something that you might notice you didn't have before, and then it's happening, it's back pain. This is because of the weight of the baby, because as the baby continues to grow, the posture of the mother changes, and as it changes, it is going to it is going to strain the back, and that is why you're going to have the back pain. Well, you might need someone to massage your back. Sorry for that. You might need someone to massage your back. The other thing, you need to avoid heavy duties like a lot of lifting and bending a lot, and also avoid wearing shoes, the high heels, because that is going to put more strain on your back, and you're going to have more pain. In case the backache is very severe, you don't need to continue staying at home. You need to come and see your doctor or your nurse, the one who is taking care of you, and they're going to be able to come up with a solution, because sometimes as some of these minor disorders might flip over to some other, maybe you have another underlying condition, and if it's not managed, we might continue thinking it's a minor disorder. The other thing that is very, very common, it is leg pains, leg cramps. Leg cramps. They're very common, and what we can advise you to do is eat food that contains potassium, and like bananas, and also calcium rich foods like milk. That is going also to help. The other thing that is very, very common is frequency in urinating. This is obvious because there's that pressure that is applied by the uterus on your bladder. So every time that you take a little water, you want to go and try to empty the bladder. That is very, very common. So, and the other thing that is very common is changes in sleep. Especially in the first trimester, you might find that you're sleeping a lot, but as you move towards the that trimester, now it happens that now you do not have the sleep, you're getting insomniac. So it is normal. I can just advise you to maybe bear with the condition and the situation, and as time goes by, this is going to calm down when you maybe deliver. But whenever you get a time, you can take a nap, and also get a quiet place where you can be able to sleep. Maybe for any other thing that I might not have mentioned in the video, you can we can mention it there on the comments below. But I hope this was helpful to the pregnant mothers and anyone else who would want to get pregnant. Kindly, I would ask you, do not get scared of getting pregnant because of these minor disorders, because it's not everyone that experiences the minor disorders. Some people have such a smooth pregnancy, so you should not really be scared of getting pregnant. And even if children are a blessing, and I can say maybe the minor disorders are just a blessing in disguise, so you should not shy away from getting pregnant. And I pray that when you get pregnant, or if you're in the journey of pregnancy, that you're going to carry your baby to term and you're going to hold your bottle of joy. God bless you. Until next time, bye bye.